Sorry, just before team from Birmingham joins, just to say that we will be here for the entire 2 days, and Ian and Kate from the central programme team will be in this zone to take all your questions around the GD and the blueprinting programme, and also myself and others from the programme team will be on a final panel tomorrow afternoon for any questions and answers around this programme. So please interact with us as much as you can, ask questions. It's very important that as the programme evolves, we start to harvest ideas from other digital sites in the NHS. So please come and speak to us and ask us your questions, give us your thoughts. Thank you. So over to colleagues from Birmingham. Thank you.
Okay, thank you. That's great. Good morning, everyone. Hopefully you can hear me. I'll try and project. It's a bit noisy in this building. So we're here today to talk to you about the approach that we took at Birmingham. So thinking about what blueprinting is, what our journey was and what lessons we learned that we felt that we could share with you. Focusing on the work that Katie's been leading on with the Blueprinting Steering Group around development of patient portals and underpinning principles of patient portals. And mainly what the key decisions are when, as a digital fledgling, you're about to embark on a journey that others seem to be racing ahead with and you're not quite sure where to start as an organisation. We don't want it to be death by PowerPoint, so we would encourage you to ask questions as they occur to you as you go along, and hopefully we'll get some time at the end for some Q&A. So a little bit of contextual information about the organisation. So University Hospitals Birmingham is one of the Shelford Group. It's a large teaching trust in the centre of Birmingham. We've just merged with Heart of England Trust. Heart of England Trust were our designated fast follower. And our metrics have gone off the scale in terms of we now 20,000 staff with 3,000 beds and a patient population of active treatments of over 2 million patients a year that are going to be going across 5 sites. And in terms of the fast follower element of that and how blueprinting will help us articulate and help our colleagues across at Heart of England, former Heart of England Trust, they're at 2.4 on their digital journey as the HIMSS rating, and we were at 5.4, and it's about bringing them up to parity and then moving forward together as an organisation. So when we were preparing for our day today, we were thinking about what blueprinting meant, and when we signed up to be a GDE and we filled in our funding agreement beginning of last year, beginning of the year before, 2016 maybe, blueprinting was a word on a page that we as a GDE were committed to working and collaborating with NHS Digital to develop the concepts. The dictionary definition is interesting. It actually looks at that it's unique. Blueprinting is unique to an organisation, but equally it's not unique. It can actually set out the standard and set out a framework, which is what the team at the national level are trying to do, which gives you a set of underpinning principles to be able to embark on a journey and deliver success for your organisations. You can get blueprints for policing, interestingly, a bit of research there. You can get all sorts of blueprints which tell you how to police various things across various organisations. You can get blueprinting for hotel services. You can get blueprinting for running your restaurant. But you cannot get blueprinting currently to inform your digital health journey, which we thought was quite interesting. So in terms of the developing digital footprint within an organisation, what are the principles that we felt that we could bring to the table around blueprinting? So we're leading on a particular pathway in a particular work stream, but for us it's actually wider than that. There are some underpinning principles at the start of any journey which you as an organisation need to address. You will have an objective, and it's usually some sort of burning platform around a new building that's being built, new models of care that are going to be developed. and how you will join that digital revolution as an organisation that seems to be going on around us. And when we first started on our digital journey, not many people were on that bus, but as we've progressed on our journey, lots of people have joined, and lots of people are actually overtaking us now in terms of Cambridge and what's been achieved at Cambridge. So for us and for the deliberations that we had, it was about where do you start? What's the blueprint for the blueprint? What are the questions that you need to ask? What are the key questions and what are the key decisions, and where do you go to get help? And this is what the GDE blueprinting programme is hoping to give you, the underpinning principles of where to start. So the key questions, certainly that we asked at Birmingham, was around the governance framework. You can't do this without strong clinically led leadership. What the organisational culture is like. Now, in my experience, every NHS organisation's culture is rooted in paper. We have, if you look at the National Archive and look at the medical records that were used in World War I, they're exactly like the medical records that are used today in principle. They're paper folders that are structured in the same way that our records are structured now, with all key elements of information to be able to usefully and productively treat that patient. And our clinicians like paper. They intuitively navigate around notes. They know exactly where everything is based on the colour of the clinical noting paper that they use down to where the mount sheets are for their results. They don't want to give it up. It's simple as that. And when you actually do make them give up their paper, how are you going to store everything? Where are you going to put everything electronically that's not in a big medical records library down the road, but is able to be mined and accessed intuitively by your clinicians through an electronic medium? And the question that we asked ourselves a lot in our early journey was, what makes an effective electronic patient record? What is meaningful to the clinician? And if you ask any clinician that, they'll all give you a different answer. And the big question we get asked from any reference site visit is, what have you done with all the paper? Did you scan all your historic data? The simple answer is no, but we'll come on to that later. And if you are taking the paper away, what are you replacing it with? What is your methodology for data capture that's quick and easy for a clinician to use, that doesn't add seconds even? We talk in seconds when we're working with clinicians to their day, and doesn't take 200 clicks to get through a form. And the big thing is, what order do you do things? What's the blueprint for how you approach the order in which you execute your delivery? What's your training model like? And how are you going to make informed decisions about all the questions that we've just posed? Where do you start, basically? The first place you start is that is not an IT project. This is about clinical transformation that is underpinned and enabled by good IT. It is not an IT project and should not be led by IT geeks. And I count myself as an IT geek now, although I do have an ops background. So in terms of your key decisions, your leads for your governance framework need to be your CCIO and need to be your medical director. In UHB, we are very fortunate. Our model is that our IT team report to our medical director. Our clinical IT is overseen by the medical director, and our ethos and our reason for doing this was not about saving money. It was about improving patient experience, improving clinicians' experience, and actually improving patient safety and outcomes. You cannot do EPR